everyone. This is Dr. Syed Haider, and I haven't really decided what we're going to call this, but we'll go with the Dr. Haider Show for now. Brought to you by my GoToDoc, which is a website that I started, and drsyedhaider.com. So today we have with us an amazing guest. I actually just did an interview with her. I don't know, it seems like almost yesterday. It was maybe a week or two ago. And she was the first person that I spoke to, who interviewed me that I really wanted to interview, actually. So I'm so glad to have her here with us. She's Rose Torres-Carrion, and she's a hospital administrator, and she has kind of a behind the scenes, view of what's been going on in hospitals since the beginning. She was working in a pediatrics unit in a hospital when the pandemic hit, and I'm so interested in just finding out her experience from that side of it, because I was working in a hospital from a physician's point of view, but the physicians working in hospitals, unless you're in administration, which I wasn't. A couple of physicians are. Some physicians are in administration. If you're not there, you really don't know what's going on from that side of the fence. So let me just bring her on, and we'll introduce her. Hey, Rose, welcome. Thanks for
Hi, Dr.
thanks for
Hyder.
coming.
Thanks for having me. I'm super excited to be here.
Yeah, absolutely. So first of all, just give us an introduction. Like, tell me and my viewers, basically, like, what is your background and what were you doing when the pandemic hit?
So, I'm in health administration. I do patient experience work. And so, I'm a patient advocate essentially. So, I do improvement work in the hospital around communication at bedside and how to improve communication with all staff from leadership to frontline in the hospital. And we're a health system. So, it's actually for the whole health system. We're pediatrics.
Hmm.
And I don't give the name of my institution because, you know,
They might not like that, sure.
they will definitely not like what I'm up to. Definitely
No,
not.
no problem. But we know you're in the continental United States somewhere. So,
Yes.
so the
Well, I'm in
U.S.
Central
healthcare
Florida.
system.
hmm I'm in
Okay,
Central
cool.
Florida. I've been saying that.
Yeah. So, what were your experiences at the very beginning? Like, what do you remember? Like, casting your mind back to the beginning of the pandemic. We start hearing about a virus coming out of China. What were people talking about in the hospital, and what were you thinking, and what were your colleagues thinking about it at the time?
Well, it's funny. I was actually on vacation in Cancun. The first I heard about the virus, and so when I got back to work, I was supposed to fly into another location for work, and they canceled our trip, and they decided to kind of just do everything remote as much as possible. So we are pretty technically savvy, and for the safety, everything felt very safe in the beginning. They sent everyone that they could home. So, of course, we trusted the health system to make the best decisions for us because they really did. They really did try to do that. And as other institutions were laying off staff, we really tried to redeploy the staff to different areas to support those that were, working with COVID. Now we were pediatrics, so we didn't have a huge surge like you heard about in adult care. We actually thought that we saw some patients before the pandemic. So we were really busy October, November, actually, before the pandemic was announced. And, there's some rumblings through the staff of, well, maybe that was the first wave of COVID and maybe it hit kids first. And we didn't know. And that was kind of the discussion, amongst staff initially.
So, do you remember? Were they? I mean, usually they test everyone for the flu. Were they like not
Nobody
finding
tested
flus?
positive, not
Really?
flu, no flu. And so that was the confusion. It was not flu. The kids were not getting better. And they were actually, we had the highest utilization of vents that we had ever had before. So we did
Of
have
what?
vent use,
Oh, vent
ventilation.
use in
Mhm.
children.
In children, because they had so much fluid in they never figured out what it was because we didn't have the testing then, and so it's just speculation. We're really not sure, but
Were
that's
these
what we experienced.
teenagers, or was it like the entire spectrum of pediatrics from
It was, I would say, adolescence. I would say adolescent, yeah,
like maybe were
9 and
yeah,
above.
because there was this whole thing about vaping, right? That at some point, like in I don't remember when
Yes,
that was, 2019 or 2020 in the summer or something, right? They had this.
and we were actually concerned about the vaping. We actually did, kind of a session like this for patients and families to teach about the vaping, but we didn't none of the I don't know, I'm not clinical, but none of the staff mentioned it towards vaping. The age range was too large. It was from 9. We had a 9-year-old. We had, but it was the busiest that we had ever been for respiratory illnesses, and we had them coupled with, we had some also with RSV. So we did see a lot of RSV as well.
Mm. And Yeah, I mean, usually when something like that happens, like the staff also gets sick, right? Like
And we
gets
did not
spread it to
have
everyone.
staff. We did not
Really?
have staff getting sick. We did not. And it was
That's
kind of
kind of weird.
right. It was kind of, so that's why no one understood what it was. And we weren't using PPE protocols then, like now. We didn't know what it was. Didn't seem to be spreading. We used PPE, but it wasn't the protocols that they, mandated for
Yeah.
COVID. Not so
Yeah,
crazy.
so yeah, so I remember when this first hit, like, I think people oftentimes think that like doctors know a lot more than we do. And so I have to like disabuse them of this notion, like we're very specialized and very focused, right? So like I'm not an expert on masks, right? So when we started masking up, I was like, I guess this makes sense, like, if it's good enough for doctors and good enough for the OR, like, and I didn't even know until much, much later that masks really don't stop it, right? That they don't even they've actually been found not to do anything for the flu and for upper respiratory viruses. So I wasn't actually aware of that. I didn't know that, right? That the masks were like just theater, right? So
Theater.
was it the same, like we were just masking up and we were wearing N95s and like everyone was just like very uncomfortable all the time. Was it the same at your place, that they just all of a sudden overnight everyone's masking and
I
being super
think
careful?
I think if I think back, I think it was really when the CDC really started pushing out specific guidelines and the contagion levels,
Mm,
right? So it's super contagious, and just the panic that they were putting out in the media about how contagious it could possibly be.
mm,
I mean, I remember they were telling us to wash our groceries before putting them in the door, bringing
yeah,
them in the house and
right.
throwing away right. And we
Yeah,
know it's viral. It's not born. It's not. It's
yeah,
airborne. It's not.
yeah, yeah.
Where you touch things. So, once the fear started getting pumped in the media, our staff were scared and were wanting to use masks. And they also understand masking protocols and the safety of masks. So there was a point where there were specific masks that had to be used. They're the N95 ones, they're the,
Mhm,
the ones that are fit, and they had to use a brown paper bag. And now you understand that once you put it in the brown paper bag, everything is soiled. And once you take it out of the brown paper bag and put it on your face, now your face is now soiled. So they understood this concept, of course. And so people were upset with that. But when you talk about PPE and the shortages that we had, I mean, that we had to just make do with what was best. But I think that was the biggest fear because people did know, these cloth masks. One of the great things that the hospital did, because people were afraid, is we made masks in the hospital. We deployed
mhm.
staff to actually sew masks. So it was an amazing thing of coming together. In the beginning, it was great because we were all supporting each other. They gave us the materials to do that. And so we had staff sewing masks
Yeah, I
for
remember that. Yeah,
other
we had the
staff.
same thing. Yeah, I saw
Right.
this going on.
Yeah, so it gave people a sense of safety and control, but now we know, of course, it was all theater. The microns, it's just too small. It's just too small.
Yeah, so like thinking back to that time, now I'm starting to think like obviously like the CDC knew that masks weren't going to work, but I think they were just giving this to people even in the medical field as like something to do to make yourself feel better, right?
I
And
agree.
and so not entirely theater, but more of like a safety blanket kind of thing, right? Like, for
That's
your face, like for
exactly
children.
what it is. It's exactly a safety blanket. So
Yeah.
I'm going to use my eyeglass cleaner, right? It's literally a blanket. I'm just
Yep.
it's a security blanket. And
Yeah.
it's funny because I did some digging and I found the research from the Spanish flu in the
Hmm.
1900s. And in that study, and I can send it to you later as well. They actually talk about knowing that the masks don't work, but because it was a safety mechanism for people that they felt safe, they gave instructions in the newspapers on how to make your own mask so that people felt safe. So it is a
Wow.
false sense of
Same
security.
exact thing that happened here, right? There were all these like tutorials, like make your own mask and even make like souped up versions of different masks, right? Like I remember these tutorials where like people were sewing like double-sided cloth and then you would slip in like a filter or something from like,
Coffee
Home Depot
filter.
or something. Yeah, coffee filters. Yeah. Yeah, wow. Wow, the same thing.
Yeah, it was. I'll have to send you that study. I found it in my endless digging, and I've had conversations with people at work with the mask, and they're like, "Oh, you don't know what you're talking about. That's not true. The masks work. The masks work." I said, "Show me one study where the masks work. Show me one study." And so I think I've convinced a couple of my colleagues, that it's theater, but it's because of what you said that medicine is very subspecialized, and so you spend all this time doing this study, and we talked about this when you did my show, all this time studying the one specialty. You don't know the rest, and so you have to kind of just lean on the knowledge of your peers and pray and hope and or have blind faith that they're right, and that's what we've seen happen.
Yeah, I mean, if anyone knew that masks didn't work, it would be like the people that you go to in the hospital for like the fit testing, the safety
Right.
testing, right? Like, and for the N95s, somebody in that department must have known that this was all a big joke and that it wasn't going to do anything. But like, so at what point did you start
Fauci knew.
to? Yeah, yeah,
Fauci.
of course. I mean, the CDC, that they knew this from the start. So at what point did you start to like look around and think like there's something wrong here, right? Like, at what point did your kind of spidey sense start tingling and start thinking that there's something weird going on here?
Well, when they shut everything down and they told us, work from home, and I was supposed to travel, and they told me I couldn't travel, I was like, wait a minute, I was ready to go out. So I started, we were locked inside. I started doing research and started studying and studying. And just the lockdowns after 10 o'clock, you can't be anywhere. Like, does COVID stop? Or does COVID stop during the day and works after 10? I'm not
Yeah.
really sure. I didn't even know we had lockdowns like that in the city because I wasn't paying attention, because I wasn't a news watcher, because I haven't watched the news for
Mhm.
years, because it's a lot of propaganda. So I just started reading, and then I saw some really controversial things come out about the frontline doctors when they went to DC, and the infamous in front of the steps, right? And they had that 3-day symposium with the medications, and I watched the 3-day symposium, and I read all of the data that they presented at that symposium, and I presented it to our respiratory people, the director of respiratory, and he said he wasn't going to read it. And I thought, this is so anything that Trump pushes, I'm not going to read. And I said, don't you?
Did he actually say that? Did he actually
Yes,
say anything that Trump pushes? I'm not going
yes,
to even consider.
yes. And he
Wow.
said I was a better person because I would. And I said, but don't you want to know about this medication? I mean, my sister may possibly go on this medication to a possible lupus, um,
Yeah.
uh, diagnosis. And so I thought, I need to know about this medicine, because if they're saying it's so unsafe, right?
Right.
I want to learn the long-term effects so that I can protect my family. So between that and the staff and the rumblings about October, November, maybe that was COVID. And then our respiratory teams kind of like, we've gone through respiratory folks like crazy, which means to me we're not supporting them to do the work, or we're not listening to their feedback on how we should provide the care, or they're not receiving the resources they need to do the proper care. So between and the other thing is, all of a sudden we had this push to vaccinate last year. That's when I really got because I was in the background. I was like, you know what? They want me to work from home. This is a sin what they're doing, where you cannot go in with your family member. And so I was talking to all my family members and saying, you have rights. And I was trying to do the patient advocacy stuff within my own sphere. But once they mandated the vaccine, after telling us last May, so almost a year ago, they said, no, no, no mandates for the vaccine. Absolutely no mandates for vaccine. We don't know long-term studies, what it's going to do, what the impact is going to be. And then in early August, they gave us less than 30 days to vaccinate or lose our jobs. And then I was done. That was it for me. I said, I don't care if I lose my job. This is not going to happen. I created a support group. I had over 150 people. I felt like I was doing an underground railroad, because I had leaders under the table sending people, giving them my personal phone number so that I could help support them and really do peer support. I mean, I would talk to people every single night, had people crying in my ear, not knowing what to do. This really does go against many people's religious beliefs, the vaccines. Those, I watched my organization deny medical and religious exemptions. I mean, after that, I just could no longer be quiet.
So you started so you started speaking up with like hospital management or higher ups.
Leadership.
Um so hospital leadership, how did they respond?
I have a pretty good reputation from the work that I do because I function like an internal consultant. And so when we do patient improvement initiatives, we usually have some good successes. And so I have trust within the organization. And so people will listen to me and I get that glimmer of hope. I see a twinkle in the eye when I present the data for just a moment and then it's gone again. And I think we talked about this. It's like disassociation disorder. Like they cannot fathom that something would go against what they've blindly believed in. Right. So I shared in a huge team, I said, this is systemic racism. Black and brown communities have a barrier to work. And by the way, I do diversity and equity work internally in that committee. And then I was told, and I showed CDC data, right, from the CDC. And I was told, oh no, those disparities, they don't exist. And then we get a grant for $14 million to vaccinate Black and Hispanic children. So does the disparity exist or not?
Yeah, it's excuse me. It's
It's
like
okay.
whenever it's convenient, right?
That's exactly it's. I'm not sure where to look. I keep looking at you on the screen or up at the camera. Sorry. Yeah, it's about convenience. Um, the other day they presented how proud they were at one of our breakout sessions. Get some water. So I have water right here.
I'm good. I'm good. Just got something stuck in my throat. You got that tickle in your throat sometimes.
Yeah, I did.
Um,
I did that earlier. So when I present the data, when I really gave up internally is when I started presenting data, my business cases, my solid business cases. People either wouldn't look at them or would read them and say, "No, that data is not true." Based on what? Why is the data not true? I'm giving you data from the CDC that shows that there's disparities. If you create a mandate, and we had massive amounts of Hispanic employees at one of our facilities leave. I mean, they left during the flu mandate. So we'd never mandated the flu vaccine any other year until uh, you know,
really?
well,
Wow.
COVID started. We'd never mandated that. It was, do you want the flu vaccine or not? If you don't take the flu vaccine, you can wear a mask. Which we know the
Yeah,
masks
yeah.
work, but we would wear masks for flu. So when the mask mandate came out for the COVID um, uh, virus, and people say, "Oh, well, now you have to mask." I go, "Well, that makes sense because if you don't take the vax for flu, and you have to wear a mask." So, people people are just going with blind compliance. That's what it is.
Yeah, absolutely. So I remember at one point seeing this video of parents. They had their kids all masked up and in almost like a spacesuit, right? Like they were completely sealed everywhere, right? And then you see them run outside the house and go hug their grandparents. Okay, this was their preparation to go meet their grandparents. And so I just remember thinking, like, I mean, if anything, you would put the grandparents in the spacesuit. I mean, they're the ones who are at risk. Why are you going to such extreme lengths trying to protect your kids from something that they have no, danger of, even if they catch it, it's not going to harm them. So you dealt with pediatrics, right? And so did you come in contact with a lot of parents and kids and like get exposed to this kind of like the insanity of the fear that they were kind of imbibing from the media and everyone else?
So unfortunately, our parents were in a lot of fear. So I do family advisory council work, and so yes, our families had a lot of fear, and I think that's one of the things that medicine made worse. Our industry made the fear worse because instead of reducing and alleviating anxiety and suffering, which is what I consider my role to be through communication, and saying we are following safe protocols while you're in the building, we've had zero infection rates between our staff and our patients. Instead of doing this kind of measure and conversation, we allowed the fear to, you must sanitize, you must stay 6 feet apart. We put the stickers on the floor. We created the lines in the so if in a situation that was already stressful, we made even more stressful because we put in a funnel before you could get in, right? So you had to go through the front door. Now you're funneled. You have a wait because you have to go through the questions and the temperature check, and then you have to go through security, and then you have to check in, and then you go to your area. And so we created this funnel to try and keep things out and it made suffering worse because now you're in a line and we're with all these people where normally you would just go to the area of the hospital where you needed to go and you wouldn't necessarily have such a long line and you check in fairly quickly and you sit down in normalcy. And so I think in the guise of trying to be safe and do a lot of the things that we did was in the guise of being safe,
Hmm.
and we actually increase the anxiety and suffering of our patients and families. So I was in a meeting yesterday. I'm on the board for a communication group, an academic institution, and I told my team, I said, I have watched the demise of patient rights occur during COVID. We have decided that we're going to step into our power and authority in healthcare because it's a position of power and authority, and wield our power against the patient and family. And that's really not what we're here to do. We're here to provide a service and to help you to live your life to the fullest, right? And help you to get to the place where you consider yourself healthy and you're actively participating to your fullest capacity in your own life, right? That's for me what healthy means. And we did the exact opposite. We didn't give any preventative treatments. We didn't tell, we told people to stay inside. We didn't talk about the vitamin D studies. We did, yeah, it's a lot. I could just keep going on and on and
No,
on.
yeah, no. So, did did you have any experiences trying to bring this stuff up with whoever was in charge of
I
the
did.
case?
I had one-on-one conversations with leaders where I tried to present the data and I said, why aren't we working on this? Why are we telling adults that they have to vaccinate? We are not insured to treat adults. Our staff, our
Wait, so you
doc,
were telling adults they had to vaccinate? Like
well,
which
if you think about
adults?
we rolled out the vaccine mandate at the organization, and so doctors are telling staff, it's safe, go get vaxxed. It's
Hmm.
safe, go get. Well, the truth of the matter is we're pediatrics and we're not insured in that capacity. So we really can't tell staff that because I don't have your medical chart. So that's one.
Hmm.
So that I was successful on that battle. The other
Wow.
battles we had a Moderna consultant that was leading the way in our vaccine and our protocols for COVID and all of that. He knows who he is. And so I complained that we had a consultant that obviously has, that's you have a problem if you're a consultant for the Moderna company and you're rolling out the vaccine mandates in an organization. It's a
Yeah.
conflict of interest. So
Right.
I brought that up, and so he wasn't utilized as often for head of, for the face of the decisions that were being made. I had conversations. I mean, I had a pathologist that joined a meeting and it's not a choice. It's not a choice. Everybody has to vaccinate. And she was just so just pushing the vaccine. And I said, actually, it is a choice. We have a thing, it's called informed consent. It's the law. There's a 4-part process. And let me tell you what that is. And let me give you the NIH documentation on that. And, you know, that kind of quieted some people down. So
So how did informed consent work at your organization?
well, that was one of the things I complained about. We just told people that they have to vaccinate, and we didn't really
Yeah.
give the options. And I told you we have a large we had a large Hispanic population that was working for us. And so, informed consent is 4 steps. I give you a treatment, and I give you the risks of that treatment. I give you an alternative treatment, and I give you the risks of that treatment. Then I have to assess your understanding, and then I can accept your decision or not, to say yes, you've made an informed decision. So people don't understand that, and you can look that up. It's on the NIH website. I'll post it on my website as well. I'll have to find it again, but it's there. It exists, and so it made people pause. When you give people that kind of information, it makes them pause. This is why I say I'm a patient advocate, because I want to teach people what their rights are. I've watched those rights just be completely demolished. So we weren't doing that for our staff either when we were giving the vaccine, nor were we doing that for our staff that were contracted employees. So to be a contracted employee and work in our building, you also have to follow the same protocols and be vaxxed. And so we didn't do that for them either. And so you have a problem if you're not performing the informed consent. If you're not giving people their information, if you're not giving them the alternative methods, and as a matter of fact, you're denying alternative methods. Uh,
Yeah, so when you brought this up about like, hey, everyone knows that we're supposed to inform consent for any medical procedure or any medical, intervention. What was the response? Did they like brush it off, or did they start actually
They
creating
slowed
informed consent
down.
with
They
staff?
slowed down. They did. They slowed down. They started to make videos, what they call education, but the videos are just propaganda. It's safe and
Right.
effective. So they did
So did they
make.
literally say there's like no risks of this vaccine?
Oh yeah, we were told it's safe. 100%. It's safe. What are you worried about? What are you a conspiracy theorist? Rose, if you're hesitant, maybe you should speak to one of our infectious disease docs so that you can be better educated. I never said I was hesitant. I was making a business case for our staff and our patients, saying that one, there's a barrier to work, which is the definition of systemic racism. If you want to use it's racism, it's power. I'm using my own power and authority over you to oppress you. That's what I've seen all over the place. And this is not, people say, why do you use these terms? Well, I'm trained in this work and cultural competency. And also you have to know how to talk to people at their level. Right. So when I started working with physicians, I'm not a physician, I'm not a clinician. I had to educate myself so I could speak at that level. You have to meet people where they are. And so when I put it in the terms that they understand, I was talking to a lawyer actually at the event that I was hoping to see you at over the weekend in Oklahoma. I was talking to a lawyer and she said, why are you using those terms or Marxist terms? Why don't you use feudalism? And I thought, well, I never thought to do that, number one, but I'm fighting fire with fire. So we have to stop saying that
Yeah.
these disparities don't exist. They exist. It's how we approach them and it's how we manage these things that makes the difference. And so I was able to make an impact, but it wasn't enough. We were still pushing for the mandate. People still lost their jobs. People applied for medical and religious exemptions. They were denied.
So
Uh,
did they explain that at all? I mean, did they get any pushback on like how can you deny my exemption? I mean, it's like a valid
they
exemption.
they got pushback and they did not accept appeals.
Wow.
And I got silenced. People stopped talking to me. Eventually, I mean, I wouldn't stop talking. If any leader I could grab, I would explain every perspective, and I would give them the business case from which I thought they understood. So if I'm talking to diversity and equity leadership, I'm going to give it under that perspective, under that guise. I also brought up the VAERS database. I was told that we could not use the VAERS database. It was an unreliable database because anybody could report. That is the database of which the CDC approved the EAU. And by the way, if you have these other alternative treatments, you don't need the EAU. So why would we tell people that there's alternative treatments? Right.
Yeah.
So there's no way to have informed consent when I digress. I think you know all of these things. I
Yeah,
don't know.
it's like you're just banging your head against the wall. You
It's
just like
exactly it's
people just it doesn't make any sense, and they can't explain it in a way that makes sense, and it's just like groupthink, right? You're just confronted with groupthink, and like, was there like, did you have any idea where was the pressure being applied to people in upper management? Like, was it just because everyone's doing this? Or did you get the impression that like, they got a call from somebody at some point higher up at some
well,
level who just
our
said this is
CEO
what we're doing?
definitely told us in the prior year we weren't going to mandate it. And then we had the wool pulled over our eyes or the rug pulled out from under us, whichever term you want to use. And it was mandated within less than 30 days. I do believe that there are some connections there in leadership with administration, with the current administration, that they knew what was going to come down the pipeline. And so they made the decision to be ahead of the curve. Do I have that in writing? Do I have the data that shows that? No, I don't have that. Can I see with open eyes, what happened and assess and make an informed assessment? That's my assessment. So that's my opinion. Others may think differently, but I mean, the fact that no appeals were taken, what's the reason? What's the cause that you wouldn't take an appeal? Why would you be so adamant on
Yeah.
denying medical and religious exemptions? The only thing that was mandated is that you put the mandate in, and then legally you have to give the exemption. So as long as you get everyone on that tracked, right? Tracked, you're compliant. So I
Yeah,
definitely
I
think
was always confused by this. I mean, what was it that, why can't you even allow exemptions? And where did that come from, right? Like, and everyone did it. It was just like we saw like every country do exactly the same thing. We saw every hospital system, every clinic, every most companies in the United States, they all did exactly the same thing. It was all like,
I was
okay, now we
shocked.
got a mandate, and now we can't accept any exemptions either, right?
I was shocked. So my institution was part of a pediatric collaborative that formed together to write and support, I think, the American Academy of Pediatrics, or I can't remember which order, to say that this is the way that we recommend. And anyone outside of this thought process. So we need to vaccinate everyone for the safety of the patient. But I'm also a patient. So what about my safety? So if I have medical exemption, why are you denying me? And so we had a lot of immunocompromised folks that have allergies to other shots that are exempt, that were denied that same exemption for the COVID vaccine. Whose safety are we protecting? It's under the guise of what?
So as time has gone on, right? Like, you can see all these YouTube videos that have compiled like the efficacy of the vaccines is like dropping, over time. New reports coming out, new studies coming out, it goes from 90% to 80% to 60% to 50% to 40%. And now it might be even negative efficacy, right? Maybe even negative. So like has the conversation shifted? Has the environment shifted at all at work? Like have people started to like change their opinions at all based on like the new data that shows that like really you're not protecting anyone else by getting vaccinated? Does that make a difference to anyone?
I have not seen much change. We did finally get rid of the vaccine mandate in or not the vaccine mandate, excuse me, scratch that. We absolutely have the vaccine mandate, the masks
Mm.
in non-clinical areas. However, if you're not vaccinated, you must wear a mask. So, as an unvaccinated person, I have to test once a week if I'm going in person, and I also have to wear a mask no matter where I am, clinical or non-clinical. But I can go to lunch and not be masked and sit right next to you. So, makes
But I
complete
mean,
sense.
it seems almost it's just like punitive, right? Like we're just going to make you suffer for not doing this because, we know it doesn't work, it doesn't work, you know,
Yeah. I
neither
think that
one works actually. The vaccine doesn't work, the masks don't work. I mean, it's just
I think it is purposefully punitive to make us comply, and those of us, and it's worked. I've seen, gosh,
because it's really uncomfortable, right?
it's
Like,
discouraging. It's really discouraging. I've seen the steam, just
and you're
people's.
singled out also. It's like, oh, you're the one,
Yeah, well, we also have these things on our badges. I don't have one, but they're rings that they put on the badges so they know how many vaccines you have. It's not just now that you're vaccinated, but you get a badge that says I'm vaccinated. It's like a little ring badge holder. I'm vaccinated. So if you have a booster, you have an extra vaccine. And depending on the type of vaccine, if you've gotten another booster, you have 3 or 4 of them. And I walk around without you know, did anyone sue your
Oh, you
organization?
can see the chat too.
Yes,
Okay,
I can see
cool.
the chat. Of a couple, but I don't really know. I've just heard through the grapevine, so I don't really know, and I'm not privy to that information, nor would I be allowed to share it. But as far as I know, I think so. I've heard through the grapevine, but I'm not sure. I
Mm.
can't. I'm not sure, and I'm not in that area, so I don't know. But I wish they would, and I'd encourage anybody to do that if they've lost their job. File an EEOC complaint. It is your right. I believe that we are autonomous human beings and that we're uniquely made and we get to make our own decisions on this type of thing. And I think that we absolutely should stand up and fight against. I did it by working within the beast. I feel like I'm working in the beast system, you know. But if I leave, who's going to do what I do? And so I'm trying to make it better for patients and families with the way we communicate in the hospital system. And I hope I make a difference in the work that I do. And that's all that within our own spheres of influence, we have to continue to fight the best we can. But I have seen many, many, many spirits of colleagues die. So, you see people walking around and the light is gone, and it's really been just so heartbreaking. It really has been.
Wow. Um, so, I mean, that sounds terrible. I mean, just explain to me a little bit more what you mean. Like, I mean, what have you seen amongst your colleagues? Like, how has this
Well,
affected them?
Yes, I've heard of Dr. Sherry Tenpenny, and yes, I've seen her speak. And we went to the same event, and I heard her called on the airport, but I haven't gotten to meet her yet, so that's on my list of things to do. I'm answering the chat. Um, so I supported folks. So here's the thing: they pumped us full of fear and anxiety to put us in trauma on purpose. In healthcare, we know that people that are in trauma or crisis lose the ability to conceptualize and process information. You lose IQ points. We know that in medicine. So if you're using the fear mongering tactic, it's an easy way to control people. It's abusive, actually, because we know what we're doing. And so we were told no, no mandate. And then we were given, not too many months after that, the mandate within 30 days we must comply. And so it put people into panic mode, and it shut people's ability down to process. So by the time my colleagues even processed what was happening, they were either putting a shot in their arm, quitting, and some did file an appeal and got their times extended because the appeal process took much longer to process. I don't think they realized they would get so many appeals. I think they thought we'd all just, roll up our sleeve. So they received a lot of appeals. So some people, got to stay and work longer because they couldn't go through all of the appeals in the 30 days that they had promised. And eventually either also vaccinated or left on their own accord before they were fired because they didn't want to lose, their time off and their benefits. And so they put in notices and things like that. And you have people like me, very few of us that actually were approved our exemptions. My exemption letter is on my website. I was just waiting for the response to deny my exemption. I was just waiting. I said, I don't know how they're going to deny this exemption. I don't know how.
So yeah, so tell us, how did you get an exemption if they were denying people's religious and medical exemptions?
I wrote an exemption under the conviction of the Holy Ghost. And so I stated I've been an employee for 16 years. I would not stand in front of my God and say that I had resources that he gave to me that were wasted. I had an account to make, and this was, again, I do not support abortion or the use of stem cells in science or research. That is not an option. That's a tactic of the enemy, and I will
Did they
not.
try to trick you? Like, did they ask you questions like, do you use such and such pill
They
from
did
the
they
pharmacy?
did bring that stuff up. Actually, they did, and they did try to make that argument, and I think they saw the pushback that the industry was getting. And so those that only used the abortion in their religious exemption argument, they denied those and said, "Well, you can get the other vaccine
I
instead
see.
because those cells are not in the vaccine."
I see.
But it's
So it
in
was a matter of like knowing how to write the exemption request and
I'm
like making sure not to say anything that would get it denied. But it was possible technically to get an exemption. You just had to like jump through all the hoops and kind of like navigate
I,
this
I
the
don't
system.
I don't really know because we had some people that were approved on the gumption of my body is a temple of the Holy Spirit, and nothing else shall enter, and one was approved and another was denied with the same exemption.
Right. But
So
did they have to fill out like a form saying like, have you ever used this drug and do you
yeah,
use these drugs? No. No.
mm-mm,
Okay.
mm-mm.
So it was a little bit arbitrary
It was
to a
very
degree.
arbitrary, and we did have a committee that was it was anonymous, the committee. So there was a committee of three. So we don't know who denied and they were supposed to be blinded.
I
And
mean, that
so
has to be grounds for some kind of lawsuit, right? Like if there was different rules applied to different people.
who no, I really don't know. This is what my frustration has been. And I had that conversation with a couple of leaders. I said, listen, I have taken phone calls from my colleagues crying because they feel like in order to feed their children, they've had to violate their bodies in front of their God. Is what country are we in? What country
Yeah,
am I
yeah.
in? And I get a blank stare of shock. and
Did you
say,
bring up the Nuremberg Code at any point?
yeah,
How is that?
I
How did
I
people
did
respond with that?
actually. I did. They didn't answer those questions. We did send those questions in, and they were not responded to. They were ignored. But I am on the board of another health center, and so I did have a list of questions to be answered. The health system did not feel comfortable answering those questions, and so they did not mandate until the Supreme Court ruling just happened. And at that time, DeSantis had already put in the paperwork for the exemptions. So if you have a religious exemption, it has, I have a sincerely held religious belief. That's all you have to say. And then it says at the bottom of the Department of Health form for Florida, the state law that states you cannot ask anything else. And then there's a medical exemption that DeSantis created on the Department of Health website. His team created, because I highly doubt he did it himself, but that states, I have a medical exemption and it's signed by your doctor, and that's all that's required. And the hoops that my colleagues had to go through for their medical exemptions, I mean, the doctors were just asking for more and more and more and more and more and more private health information. That is, it's a violation of privacy and rights and HIPAA. So yeah, I saw a lot of egregious things, and the demise of patient rights, and autonomous rights of an individual working for a medical institution. I mean, I heard a story. Funny story. I ran into a colleague that left the organization in at another doctor's office today. I'm a caretaker. My grandmother's with me, so I had her in the office, and she happened to recognize me, and she thanked me for my help, and she wound up leaving. And she stated that they denied her medical exemption, and that the doctor was trying to contact her doctor directly. So we did have people leave and stand up for their rights, but and anyway, I digress. I could tell you so much, Dr. Hayter. I don't know if you're reading these chats on the side.
Yeah,
And
I am reading some of them. Yeah, I mean, it's really terrible what happened. It was just coercion, right? And it happened all across the country to so many people, and so many people, like you were saying before, they were stuck between a rock and a hard place. It's like, maybe I have a lot of debt, I have mouths to feed, I have so many things, right? Like, how can I lose my job, right? and and for some people, maybe they didn't have really strongly held religious beliefs, but they just didn't want to take it, right? Maybe they're just afraid of taking it, and they went ahead and did it, you know because
yeah,
they needed that paycheck. I mean, so many people work paycheck to paycheck, right?
I had another employee reach out after the whole event happened, and I had said something where they realized that I wasn't vaccinated. And they said to me, "How did you manage?" And I told them what I did. And I said, the only reason I'm here is because they have me held hostage by my PTO, my paid time off. The person had so much paid time off that they would have lost essentially a year's salary, if they would have left. And so these and so that was a non-clinical person, but I can tell you my doctors were afraid. I talked to a few docs, because no one would talk, the docs wouldn't talk to me. Number one, I reached out to a couple that I heard didn't want to vaccinate. Some just quit, and some said, I don't want to be ostracized in my field. I'm just going to vaccinate against my will. And they called it a day, and they vaccinated, and they ate it. Right. I don't know how they're doing. I haven't, they're still there. They vaccinated, and they kept on going with their life, even though it's not what they wanted to do. So my argument when I brought this up to leadership, I said, if my doctors don't feel safe to tell you that they don't want to vaccinate, how are my frontline staff going to feel? How's my check-in person, my receptionist, my person who answers and schedules phone calls, how are they going to fight for themselves? So, you say, I see the shame on the doctors. The problem is that pediatrics is very small. If you get ostracized in one area, your whole career is out the window. So it's not just that our institution mandated. These mandates went across the board. So I do know a couple of providers who left and went into private practice, and they're very happy. Anybody that I know that left the institution and stood up for themselves, they're extremely happy that they left. And those of us that stayed are trying to make the best of it. That's what I can say.
So when it was approved for children, what happened? Like, what did you see happen? Did a lot of parents start, like, just rush in and ask to get their kids vaccinated?
Well, we actually did a survey on vaccine to uptake to see, as a part of the Family Advisory Council, to study that. And what we learned is that most families didn't want to vaccinate their children in our own study, in our own survey. It wasn't a study, it was a survey. So there's a difference. I just want to put that out there for the medical people. So we did do that. And those that did want the vaccine got vaccinated fairly quickly. I was actually paying attention to the vaccine rates on the websites that the government was reporting. And the first couple of weeks that the vaccine came out for kids, we had a bunch of clinics. The first couple of clinics were full. They wanted us to volunteer in those clinics and push those vaccines. I said, I absolutely will not volunteer in a vaccine clinic, and something that I do not agree with. Absolutely not. So I did not do that, but we did have those vaccine clinics. And after the first couple of weeks, those that wanted the vaccine for their children, they got it. And then it was, a drop off, like a complete drop off. No one, so now they just do them as part of regular visits. So, you know, those that wanted the vaccine, those that were crazy for the vaccine for their kids, they were the first out the gate to get it, and then no one else. I mean, you can look at the numbers of the vaccine rates. Fauci, I don't know if you saw, Fauci said, now that we're phasing out of the pandemic, he said
Hmm.
pandemic, Saki said pandemic, we're going to do things differently. So I'm kind of interested to see. They also said that 75% of kids have had COVID. I don't know where they got those numbers from. I'm sure I wanted to ask if we could actually run a study on that internally to see how many of our patients had COVID, but I haven't done it. I can't just run data like that because I want to, right? But I'm really
Yeah.
curious to know, where the hell did they get those numbers? Where?
So did you hear or uh, hear of any kids getting really sick with COVID at any point in your
Yeah,
system?
sure. Sure. There were some kids that were really sick, but they all had comorbidities.
Like
So,
what kind of comorbidities?
um, Well, so I'm not clinical, so I can tell you what I heard through the grapevine, but like diabetes, obesity, same that you see in the adult
Hmm.
care, and they were teens. We did have the Kawasaki syndrome that came through with some of the kids, and that's really what they were concerned about, is that if the kids had COVID, that then they would have that syndrome, which is basically inflammation of all of the organs internally, and then the organs start shutting down. So that was the fear of what would happen. I don't think that we actually saw that. We saw a few, but it wasn't, the fear mongering that they push. I mean, you look at what's happened. We have a vaccine that has zero efficacy, and for something that has a death rate of less than 1%. So it was the fear that was being pushed, but that was the fear that we had, is the organ failure. And we did have one or two, but it was so rare, so rare. I don't know if you saw when the government said they messed up on the numbers for kids that had COVID, and they retracted the numbers and rolled them back 25%, and then it was another 40%. But by then it was already too late, because
Yeah.
Sonia Mayorta, the moron that she is, had said we have 10,000 kids in the hospital dying of COVID, which was a complete lie. That did not occur. That data was just an exaggeration out of that she pulled out. It was an exaggeration. That was not a true number. That just never happened. And so that type of fear mongering is irresponsible. So I'm sure, like me, you're worried about being censored, right? And so that's the type of thing that needs to be corrected,
Right.
not the type of thing where we're providing care. I mean, this weekend I met 5 or 6 doctors that have all, along with you, have treated more thousands and thousands and thousands of COVID patients with these other protocols, and no one has died. No one has lost, not one patient.
Right. Yeah. Did children actually die? Did some of those kids who were
I
sick
don't know that
become
we
it?
had any kids that passed away. I did not hear. Again, I'm not clinical, so I only hear what happened. Usually, typically, I would hear that kind of thing, but I didn't hear about any deaths of COVID. But again, I don't have access to that. So, but I mean, if we would have had hundreds of kids dying of COVID, I would absolutely know, because we have a very small morgue and we wouldn't have been able to handle that. And that would have downstream impact on other things. So, yeah, no, I
Yeah.
didn't hear of all of these kids. No, it's an exaggeration of the media and the fear mongering and the propaganda. It's propaganda. We know it's propaganda.
Did anyone at your facility get in trouble for trying to do like a real informed consent with anyone on the
I
staff or with children or parents?
I didn't hear of any cases of that. I didn't.
Mm.
It's one of the things that I've been putting in my education to remind people of the patient rights. It's something that we're hoping to revitalize as I see that's happening. But I didn't hear anybody getting in trouble.
Yeah, but I mean, if you're not allowed to say anything like aside from safe and effective, right? Like if like where do you go to look up side effects and risks of the vaccine, right? Like do you go to VAERS? Do you, I
The
mean,
CDC, I think, put together some documentation that we wound up passing out, and they did enhance that documentation. Once it got out to the kids, I had already pushed for better documentation for our staff, and so they put out some videos out there. But the videos are not informative. It's propaganda style. It's,
but yeah,
trust
the most
us. This is
important
the
thing,
safest thing for you.
yeah, the most important thing is not like whether there's risks, right? It's like what is the risk for you given your age group and your history, right? Like what is your personal risk of the virus and the vaccine? And like what's your expected benefit, right? Like are you is do you have any expected benefit at all? Like even if the vaccine works and you're a child who has zero risk from COVID, like it doesn't make
I,
any sense, right? Like that's the
it
conversation that
doesn't.
has to be had with people for real informed consent. You have to talk about things like that that impact them personally.
I don't hear, again, not being clinical. I don't know what our docs are saying when the
Yeah.
patients are asking these questions, but um, I have really been wondering at what point are our cardiologists going to stand up? Because I'm sure that we're going to have an influx here soon if we haven't seen it already. When I went to the Defeat the Mandates rally in DC in January, I met an adult echocardiogram tech who was telling me that they were flooded, absolutely flooded with adverse reactions and also from long haul COVID, the same type of symptoms that the vaccine was causing. So the heart inflammation and myocarditis and that kind of thing. And, he was at the Defeat the Mandate rally and he gave me some stories and I was horrified. So, I don't know at what point people are going to open their eyes and see what's
Yeah,
happening.
people have these huge blinders, right? Like especially doctors. You go to a doctor and you've had a vaccine or COVID and like they just don't see the connection between the symptoms you're coming in with and the vaccine or the previous COVID. So like it's this huge blind spot in medicine because
They
they
don't
just
want to see. They don't
yeah, they
want to
don't
see.
want to see. Yeah.
They don't.
So have you heard of any kids coming back after the vaccine or even staff members having been injured from the vaccine?
I haven't heard anything about the kids, but I don't think that's something that we would necessarily hear a lot of because number
Yeah.
one, no one wants to believe it. So
Yeah, yeah, it's
I
not
did
even
have,
reported, right? Like there's a reaction and it's like diagnosed as something else, right? Some new coincidental disease developed
yeah,
suddenly.
it's unfortunate. I have heard of staff for sure. I mean, I have my own family that has been affected, that has gotten vaccinated, two of them.
What have
Um,
you heard of?
so my aunt had a stroke and lost her vision. My stepmother now has cancer. Uh, so they're unrelated, right? It's unrelated. My neighbor had pulmonary embolisms, huge pulmonary embolisms that had to be removed. So he's been on therapy that after he got the vaccine. By the way, he was going back and forth traveling from New York, all COVID, never got sick. His family wanted to protect him, convinced him to get the COVID vaccine, and then he wound up with COVID 3 weeks later and then in the hospital 3 weeks after that with full on, and his thing is he had a friend in the hospital on the vent same time as him that wasn't vaccinated, and so as I've talked to him over time he now understands that his was the vaccine, but he saw his friend so ill and vented that he said, well, it could have been worse, right? And
Mhm.
so the thing is, so for him the risk was worth it. And so, what I haven't had the heart to tell him is that those protocols in the hospital are actually what's caused his friend to probably be so ill. I don't have the heart to tell him they've been under so much stress. What else do you want to know? I could probably go on and on.
Oh, like in staff members, what have you seen in staff
Oh
members?
yeah, we saw. So I had a colleague who wound up having to leave. She didn't want the. She filed an exemption. She got denied. She wound up getting the vaccine. She wound up with daily headaches and heart palpitations. She filed with her doctor. Because her first exemption was religious, then she got a medical exemption, and they didn't want to honor the medical exemption, so she quit. You know, I had a couple of cases with really ill immunocompromised staff that their medical exemptions were denied. They got vaccinated, then their conditions were made worse, and they're still battling. So, I have three personal stories, and there's three employee stories right there. So if the risks are so rare, why do I know six? I know more than that, but I just listed six. So if they're so rare, why do I know so many myself, just myself? And that's not counting, I've gone to those websites where these vaccine injured people are posting, they just want to be heard. They just want to be heard. And we've got all these websites now with the injured. We saw, I wound up in a Facebook support group for Vax Injured, which they deleted off of the Facebook support
Yeah.
group. But I have pictures of women with clot pictures with clots, this big
Wow.
in there. And I have pictures on my phone that I downloaded from Facebook of people posting that kind of thing. Um, you know, it's really, why was that censored? Now there's an NIH study for that, by the way, if your viewers didn't know. Now the government has awarded money to study that because now they've admitted that, that's a thing, that actually happens. And it's this, it's the same with the disparities with the Black and Hispanics. After we said there's no disparities, we got that $14 million grant. Really? All of a sudden we have a 14, and it's not that easy to get an NIH grant. And suddenly we have a $14 million NIH grant for this. I mean, seems a little off to me. I don't know. Maybe I'm just a conspiracy theorist, Dr. Hader. I don't know.
I'm surprised that people actually were able to get medical exemptions. A lot of people couldn't find a doctor to even like write an exemption. There
Well,
weren't
these were
people
really
willing to
sick
even write them.
people. These were really sick people. I mean, these were people that already had exemptions for flu vaccine and
Mm,
other things.
I see.
So, mhm.
Yeah, I know in California it's basically impossible to get a vaccine exemption, and it's pretty hard in New York, but I guess Florida is a little different. I mean, some states it's a lot easier. Um,
Well,
but
DeSantis changed the rules. So he made sure that your rights were protected. So if you had a religious exemption, it's a one-page form with
mhm,
one sentence, and it says, "This is my sincerely held religious belief." And you sign it, and at the bottom of that form, it states, it gives you the statute, and it says it's all against the law to request any further information about this statement. And it's
that's
the
great.
same with the medical exemption. He did the same thing. So you have the medical exemption, the doc fills out the medical exemption, and it says, "This is all you need for your exemption." And then it
So
has
did things change after that law was passed? I mean, then all of a sudden
It
it
was too
became easier.
late.
It
It
was
was
too
too
late.
late. It was
Jeez.
too late. It did help me with the board that I'm on because again, they didn't roll out the vaccine exemptions until the last Supreme Court hearing for the medicine happened. So yes, medicine still got mandated with that Supreme Court hearing, and so then they were mandated to roll it out because federally qualified health center is federally funded for those communities that are disparate. They need that type of care, and so if we didn't implement the mandate, we wouldn't have received our funding. And you're talking about shutting off funding for a community that has no access to healthcare. You're making the scenario worse. So in some instances, you have to assess the risk. You have to assess the risk. So at that point, DeSantis had rolled out those new forms, and so in that instance, those staff members didn't have the same stress that I endured in
Mm.
my hospital, my system.
Well, I just want to give you a chance. We have a couple of minutes left here to tell people where can they find you, where can they connect with you, and you have a show. So tell us where we can find that show, and I'll put a link to it also in the description once we're done.
Sure. And I have your information on my website as well, so they can find you there too. So it's truthfromthefrontline.com. I just started this show. God asked me to speak up. And so here I am, humbly trying to speak to wake people up so that they see that everybody puts their pants on, right? One leg at a time. No one has the authority to tell you to, jab yourself or take a pill without your consent. and that you have rights as a patient. And so my show is about giving the truth from the front line. So I'm trying to interview folks like Dr. Hayter, and other physicians and frontline staff and other folks that have lost their jobs to talk about, or to talk about just their fight in the COVID. I want to give a platform for those that have been censored, because everybody deserves a voice, especially those that have been harmed and oppressed by what we've rolled out systemically through our government, and their overreach. So I'm Rose for Truth, and the show is Truth from the Frontline. You can find us at truthfromthefrontline.com.
Great. And it's just TRUTH from FROMTHE, the
Frontline.com.
frontline, frontline.com.
Yep,
Okay, great.
written
Awesome.
out.
Thanks so much for coming on. This was great. It was really interesting for me to be able to hear all this and ask you all these questions. So I really appreciate it. And I think it was really important actually to get this information out there. So I hope it lasts on YouTube for a while.
And I
Um,
hope I have a job tomorrow because I streamed it on my Facebook. So we'll see. more to,
Good.
more to,
Yeah, my brother put the link to the Rumble. There's also, we put it on Rumble as well.
oh, perfect.
So hopefully it'll last there longer than it does on YouTube. But yeah, everyone, please like and subscribe and spread this information. We need to get the word out on what's going on behind the scenes, what's going on in healthcare, and I think we all need to stand up and like insist that doctors and nurses and administrators and hospital staff have the right to refuse, right? Um, these mandates, just like anyone else in the country has the right to refuse them, and
Yeah,
is still able to have a job and still able to put food on their tables. That and so much more, right? So we just need to like, we need to spread knowledge as far as we can of what's actually going on in our country today. So thank you so much for coming on. This was really enjoyable.
thanks. Thanks for having me. Nice
Yep.
to, nice to see you
All right.
again.